Speaker, my question is to the Minister of Health and Long-Term Care. Minister, on Monday you told this House that there will be more family physicians and specialists practicing in the province. Contrary to this, the Ontario Medical Association, the people who represent Ontario's doctors, released a statement saying that your government's imposed cuts will drive new physicians out of Ontario and hurt patient care. How can you stand in this House and say there will be increases when the opposite are true? Are you calling Ontario's doctors liars?
Well, being a member of the OMA, I would certainly, I would certainly not do that. I hold the OMA and our physicians, the more than 30,000 physicians around this province, in extremely high regard. But what I will say to the member opposite, that the OMA negotiations were about one thing and one thing only. They were about physician remuneration. They're about the amount of dollars that physicians in this province earn. And historically, and certainly the current situation, is that doctors in this province, as they should be, are among the highest paid in this country, Mr. Speaker. They're also among, if not the highest talented in this country and in North America. But this is not about care to patients. This has nothing to do with access to health care for individual Ontarians. This agreement, and unfortunately, despite our umpire, retired Justice Warren Winkler, asking the OMA to accept our offer, the OMA did not. Unfortunately, we've had to move ahead without them.
Speaker, back to the Minister. Minister, in the Southwest Lynn, there's over 38,000 people without a family physician, and these imposed cuts on these doctors is not going to help that situation one bit whatever. Minister, you have failed to deny what a high-needs area is, and by doing so, these new doctors will not be able to practice in a family health team throughout southwestern Ontario. You told this House, and I quote, "Doctors are entitled to practice wherever they want in this province." However, again, the OMA has said to your government, the government has limited new graduates from practicing in family health teams. Medical students are trained to work in team-based family practice models. Yep. Why won't your government work with the frontline healthcare workers to find solutions to protect Ontario's healthcare system? Why do you find this so difficult?
Hear, hear. Well, in fact, many parts of southwestern Ontario will benefit from the changes that we're making, because we are continuing our commitment to create new family health team positions and family health team entities in those parts of the province that require them. For example, in the northern part of this province, there are roughly 40 family health teams there currently. I'd like to see more of them. And in the small towns and rural parts of this province, where there are, I think, about 70 or 80 family health teams currently operating, I'd like to see more as well. So we're continuing to allocate positions to those parts of the province. We're going to be able to define exactly what parts of the province we're talking about within the next several weeks. But certainly, Mr. Speaker, we've added 5,000 physicians to this province's healthcare services in the past decade. We're continuing to add more. We're providing opportunity, and those family doctors can and will practice in whatever part of the province they choose to.
Thank you. The question, the member from Hamilton Mountain.